Pat Shulkins is one of the millions of Americans with type 2 diabetes.
Oh, I probably have had it about 15 years.
She monitors her glucose, but when it came to the state of her feet, Pat was unfeeling. About half of diabetics have this side effect, called neuropathy.
These patients, especially when they get really bad, they lose the ability to feel their feet, so they don't know when there's a problem.
Diabetic neuropathy is nerve damage brought on by uncontrolled blood sugar. The feet and toes are most commonly affected. The lack of sensation can result in serious problems when injuries go unnoticed. That's exactly what happened to Pat.
It was like a big blister, kind of inward though. It wasn't sticking out like a blister does.
By the time she noticed the ulcer on her foot, it was almost too late to save.
The ulcer was there and it was chronic and it was resistant to care. We kind of changed courses and addressed the underlying bony structure. So we basically reconstructed her foot so that there was not these high pressure spots where the ulcer or the bone would break through the skin.
Experts stress the importance of knowing the symptoms, which may include tingling, burning, pain, or numbness in the feet, getting annual foot exams, and wearing approved diabetic shoes if needed.
And even a simple thing like an ingrown nail, it can get infected, it could get down to the bone, and you can risk losing the toe. You or I would notice a sore developing or even a little cut on your foot. People with diabetes, they have less feeling. They may not notice it until 2-3 weeks later, and by that point, it could have erupted into a full-blown infection.
Although she managed to sidestep an amputation, Pat will never take her feet for granted.
I know, I never thought it would happen.
For Lee Memorial Health System, I'm Amy Osher.